Welcome back to Ionized Ideas. This is part 2 of our patient care review for radiologic technologists. If you haven't watched part 1 yet, make sure to check it out, but if you're ready, let's jump straight into today's review. Get your notes ready, stay focused, and let's level up your patient care skills together. Which items must be in a patient's medical record? 1. Orders. 2. History. 3. Consent. A. 1 and 2 only. B. 1 and 3 only. C. 2 and 3 only. D. 1, 2, and 3. What type of precautions prevent droplet transmission? A. Contact precautions. B. Airborne precautions. C. Protective isolation. D. Strict isolation. Valid patient consent requires which conditions? 1. Before sedation. 2. Named physician performs procedure. 3. Blanks filled in afterward. A. 1 and 2 only. B. 1 and 3 only. C. 2 and 3 only. D. 1, 2, and 3. Which are examples of nonverbal communication? 1. Appearance. 2. Eye contact. 3. Touch. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. Which of the following is not a fomite? A. A doorknob. B. A tick. C. A spoon. D. An X-ray table. Which term applies when both patient and provider contribute to injury? A. Intentional misconduct. B. Contributory negligence. C. Gross negligence. D. None of the above. What is the first step in treating IV contrast extravasation? A. Apply a hot compress. B. Apply a cold compress. C. Apply pressure to the vein until bleeding stops. D. Remove the needle and locate a sturdier vein. Which statement about oxygen therapy is not true? A. The radiographer may administer oxygen at 2 L per minute. B. The rate of delivery and mode of delivery must be part of a physician order for oxygen. C. Oxygen may be ordered continuously or is needed by the patient. D. None of the above. They are all true. If a trauma patient has severe leg bleeding, what should the radiographer do? 1. Apply pressure. 2. Call ED. 3. Bandage and complete exam. A. 1 and 2 only. B. 1 and 3 only. C. 2 and 3 only. D. 1, 2, and 3. Why use water-soluble contrast instead of barium? 1. Easier to give. 2. Aspirated easily. 3. Suspected perforation. A. 1 only. B. 3 only. C. 2 and 3 only. D. 1, 2, and 3. All these isolation statements are correct except which? A. Only the radiographer need wear a gown. B. The radiographer should cleanse the mobile equipment after the examination. C. The patient should wear a mask if contagious via droplets. D. Masks are indicated when caring for a patient on droplet precautions. Which are drug administration routes? 1. Sublingual. 2. Topical. 3. Parenteral. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. If a patient complains of right hip pain but the requisition is for left femur, what should you do? A. Perform a right hip examination. B. Perform a left femur examination. C. Perform both a right hip and a left femur examination. D. Check with the referring physician. A Swan-Ganz catheter is what type of device? A. Pacemaker. B. Chest tube. Circa IV catheter. D. Urinary catheter. Which exams require diet restrictions? 1. B2. Pilogram 3. Met survey, A. 1 only, B. 1 and 2 only, C. 1 and 3 only, D. 2 and 3 only. Before entering a contact isolation room with mobile X-ray, what must the radiographer do? A. 1 only, B. 2 only, C. 1 and 3 only, D. 2 and 3 only. Which are ing tubes? 1. Swan Gans 2. Salem Sump 3. Levin, A. 1 and 2 only, B. 1 and 3 only, C. 2 and 3 only, D. 1, 2, and 3. Which is not a central venous line? A. A port A cath, B. A PIC, C. A Swan Gans catheter, D. A Salem Sump. What is the most effective sterilization method? A. Dry heat, B. Moist heat, C. Pasteurization, D. Freezing. What condition involves overinflation of alveoli causing forced exhalation? A. Bronchial asthma, B. Bronchitis, C. Emphysema, D. TB. Nosocomial infections are acquired from where? A. Healthcare facilities, B. Physicians, C. Inanimate objects, D. Insects. Which venous device is used for frequent IV injections? A. Butterfly needle, B. Intermittent injection port, Circa IV infusion, D. Hypodermic needle. All are true of informed consent except which? A. Informed consent is required for research participation, B. The physician named on the consent form must perform the procedure, C. The consent form cannot be revoked once signed, D. A parent or legal guardian is required to sign for a minor. Which is not a mechanical obstruction in infants? A. Paralytic ileus, B. Meconium ileus, C. Volvulus, D. Intussusception. What is the chest pain caused by insufficient coronary blood flow called? A. Tachycardia, B. Bradycardia, C. Angina pectoris, D. Syncope. MRI is contraindicated in patients with which implant device? A. A herniated disc, B. Cochlear implant, C. Dental fillings, D. Subdural bleeding. High osmolality contrast media may lead to what? A. Hives, B. Shock, C. Dehydration, D. Kidney failure. Delayed gastric emptying is commonly associated with which? 1. Ulcer, 2. Gastritis, 3. Pyloric spasm, A. 1 only, B. 1 and 2 only, C. 2 and 3 only, D. 1, 2, and 3. Substances that stimulate defecation but are not absorbed are what? A. Laxatives, B. Enemas, C. Cathartics, D. Diuretics. Which are typical symptoms of vasomotor contrast reactions? 1. Nausea. 2. Syncope. 3. Vomiting. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. If a patient asks to see their chart, what is the proper response? A. Inform the patient that the records are for healthcare providers to view, not for the patient. B. Inform the patient that you do not know how to access his records. C. Inform the patient that he has the right to see his records, but he should request to view them with his physician so that they are interpreted properly. D. Show the patient his records and leave him alone for a few minutes to review them. Cyanosis may be seen in which areas? 1. Gums. 2. Earlobes. 3. Tongue. A. 1 only. B. 1 and 2 only. C. 3 only. D. 1, 2, and 3. Which diseases spread through direct, close contact? 1. MRSA. 2. Conjunctivitis. 3. Rotavirus. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. During a GI series, if a patient feels faint while sitting on the table, what should you do? A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. What is the medical term for hives? A. Vertigo. B. Epistaxis. C. Urticaria. D. Aura. Blood pressure is measured in what units? A. Millimeters of mercury, mmHg. B. Beats per minute, C. Degrees Fahrenheit, degree F. D. Liters per minute, L per minute. Which ethical principle relates to truthfulness? A. Beneficence. B. Autonomy. C. Veracity. D. Fidelity. The medical term for congenital clubfoot is what? A. Coxa plana. B. Osteochondritis. C. Talipes. D. Muscular dystrophy. In what order should these exams be performed? 1. UGI 2. IVU 3. B. A. 3. 1. 2. B. 1. 3. 2. C. 2. 1. 3. D. 2. 3. 1. Bleach and Lysol are examples of what? A. Antiseptics. B. Bacteriostatics. C. Antifungal agents. D. Disinfectants.